Okay, in this video we're going to look at the supraspinatus in the short axis and the long axis. First we start with the long axis view. If you come over here you can see it's sometimes difficult to orientate exactly in which direction the tendon goes. In this particular case we're doing this maneuver. It's sort of like the modified cross position, but then we don't put the hand on the side, we just make a fist and we move the arm backwards like this. So it's just retroflexion. That causes the supraspinatus tendon to go under from the acromion here a bit, and we can get a good view. But like I said, it's sometimes difficult to see what's the exact orientation of the tendon. Does it go like this or does it go like this? A trick to find it out is that you palpate on the dorsal side the spine on the top of the scapula. And here I find the spine. The spine is going exactly into this direction. So I follow the line of the spine, I would end up more or less in this direction. But then I do the same, because anterior to it, right here, that's where the muscle belly of the supraspinatus is. And the supraspinatus follows the same line as the spine. So if I take this line, follow it downwards, come to the other side now, you can see my finger. This would be the place where I put my probe in a long axis view of the supraspinatus. Put the probe on, and then we can look at the image. I have to move it a little bit for him. Yeah, now we have a good view. Now we see the long axis view of the supraspinatus. Yes, so here we have the cortical bone line. This here is the cartilage of the humeral head. And here we see a line going up like this, and that's very typical for the supraspinatus. We call this the ski slope. It has to be a bit of a ski slope going upwards. Then you know that you are scanning the anterior bundle of the supraspinatus right here. On top of these structures here we have this hyperreflective line. That's where the bursa is. This line above here, a lot of people think that this is the bursa, but that's a common pitfall. Inside the deltoid, sometimes you see these fatty streaks. They're hyperreflective, and they cause this line below here to be very dark. And people think that this is the bursa, but the bursa is always the line directly above the tendon. So this is the tendon here. The tendon stops here, and then there inside, that's where the bursa is. In his case, this is a very thin hyperechoic line. And if I move a bit medial and lateral, you see that this is full of these fatty streaks inside the deltoid. That's a pitfall. Yeah. So here we have the footprint. This is a clean footprint. There's no irregularities here. That's a good thing, because cortical irregularities here are very strongly correlated with tendon tears. Yeah. So in this case, this looks very clean. Makes me think that there's no issue with the tendon at this position. Sometimes, even though you use the trick I just showed, it might be difficult to find this exact line of the ski slope. So then you can go, you do a little trick. What we're going to do now, if we look at the probe, we're on the tendon now. We're going to go first, we're going to go medial, like this. Then we're going to go lateral again, a bit further, like this. If we go this way, we're going to see the biceps. Then we go lateral again, we're on the supraspinatus. If we go further backwards, we're going to be on the infraspinatus. Yes, so biceps, supraspinatus, infraspinatus. That's what we're going to do now. We start from our position. Now we're on the supraspinatus. I'm going to go medial now. So if I go medial, this bone will start to fall down, will disappear, because we're going off the tuberosity. We'll go inside the intertubercular groove, and then you get the biceps tendon here. It's a bit of a strange image because we're scanning it obliquely. We go back lateral, and then we see the nice line coming again of the ski slope. We go further lateral, and the ski slope will become very flat, as you can see here. Yes, so now the ski slope is very flat, and when the ski slope is flat, that's when you're on the infraspinatus. Sometimes in the infraspinatus, if I move a bit medial to lateral, you see some little hyperechoic areas right there, very comparable to the ones we saw on the short axis of the subscapularis, because these are the different tendons of the infraspinatus. We go back again to medial, and then we have a nice long axis view again. Okay, so this was the long axis view. And we go to the short axis. If you have a very nice view long axis, you can just take the probe, rotate it 90 degrees and put it on. But as a beginner, it might be a bit difficult, so I have a little trick for you. If you look at the angle of the probe, we follow the line of the probe, we should angle it that way, so we go towards the contralateral pocket of his pants. Yes, so this is the direction that I should place the probe on the shoulder. So I do it like this, and I didn't move it yet. If you look at the image, you already have a very nice view of the tendon. Yes, so this here is the image in short axis. We call this sometimes the tire of the bicycle tire. This is the inside, this is the outside. We call it bicycle because we love bicycles in the Netherlands. So this is the bicycle tire. The anterior part is here. So if I move a bit more anterior, we should see the next structure. Remember, in the long axis when we went medial, we saw the biceps tendon. So here again, we see the biceps tendon. It's encapsulated here. We go a bit lateral again. And then we're on, all this here is supraspinatus. This is the most anterior bundle. Go a bit more lateral. I would say that this more or less is supraspinatus, and I think with him you can sort of see a line here that shows that this is the infraspinatus going over the supraspinatus. You see that? So they're all mixed together, of course, but with him you can sort of see a line in between. That's not always the case. In most cases you don't see it. In this case you can actually notice it a bit. Yeah? So this is the short axis view of the supraspinatus.